moving on into the leg, remember the leg is from the knee to the ankle. There are two bones in the leg, the tibia and the fibula. If we look at the articulated skeleton, we can see the tibia, a large weight-bearing bone, and the fibula lateral to the tibia. Notice the femur sits on top of the tibia. So if I take the femur that we just saw and place it on top of this tibia, we have the condyles of the femur matching with the condyles of the tibia, the medial and lateral condyle, to form the knee joint. The knee joint is not strictly a hinge joint. There is some rotation, but for our purposes we will refer to it in this demonstration as a hinge joint. If we look at the tibia, how do we tell a tibia, left tibia from a right tibia? Well, again, you must remember that the tibia is a bone in the leg. Not the thigh, in the leg. Two bones in the leg. Again, here we see the tibia and the fibula. The way I remembered it when I first took anatomy, fibula is lateral, and it has an L in it. Fibula. Okay, and it is also the smaller of the two bones. If you fib, you lie. Okay, a little white lie. So the tibia is more medial, it is a weight-bearing bone. The fibula is lateral, and it is a non-weight-bearing bone. So we know this is the medial bone of the leg. It should be obvious to you by trying to place a femur on it which is the knee end and which is the ankle end. The knee end is much larger. It has the two flat medial and lateral condyles surrounded by medial and lateral epicondyles, and a small ridge between the condyles known as the intercondylar eminence. Then the front of the tibia has a raised area right below the knee known as the tibial tuberosity. And then we follow down the anterior border of the tibia. The anterior and medial aspect of the tibia is actually subcutaneous. There are no muscles that cover the bone in this region. This is one of the reasons it hurts so much to get kicked in the shins, because you're mashing the sensory receptors in the skin directly against the underlying bone. There is no muscle associated with this. So we have a rather sharp anterior border. Then along the medial aspect, the lateral aspect of the tibia, we do have another interosseous border. If you remember in upper extremity, we talked about the interosseous border, or the interosseous ridge. We have that associated with the tibia and the fibula as well. If we follow down the shaft of the tibia, when we get to the ankle, we have on the medial side of the tibia, the medial malleolus. The medial malleolus is that lump on the medial side inside of your ankle. So we can see here on this particular articulated skeleton, the lump to the medial side of the ankle, the medial malleolus. So to tell a tibia left from right, it's really quite simple. Know the knee end, know that the tibial tuberosity is in the front, know that the medial malleolus is to the medial side of your ankle. If I were to try to put this bone here, I have the tibial tuberosity to the front, I have the knee end correct, but I don't have the medial malleolus on the medial side of my ankle. So this, by default, has to be a left tibia. Remember, it is a large weight-bearing bone. The tibia does articulate with the fibula. The fibula has a head which actually tucks up underneath the lateral epicondyle of the tibia, and then the fibula has on its distal end a lateral malleolus. So the tibia had the medial malleolus, the fibula has the lateral malleolus. Now the fibula has a head, remember it is not part of the knee joint, and then the tibia goes down to form the lump on the lateral aspect of your ankle, the lateral malleolus. Now it's a little more difficult to tell a right fibula from a left fibula. The easiest way is to hold the bone not so you're viewing it from an anterior posterior direction, but so that you're viewing it from a lateral view, and look at the lateral malleolus. The very lowest part of the lateral malleolus should be as close to your heel as you can get it. If you're not sure that this is the lowest part of the lateral malleolus, slip your finger around it and it should fall into a little pit or fossa. There's a little indentation in the bone there. That is known as the malleolar fossa. The malleolar fossa needs to be as close to your heel bone as you can get it. So, I'm going to kneel down and try and demonstrate this. If this were a right fibula, I'll line it up with the right side of my body. Here's the lowest portion of my fibula. Is that as close to the heel as I can get it? Well, no, I can get it closer by turning it this way. Now it's pretty close to my heel. But now I have a third problem. I can see that malleolar fossa. That articulates with the other bone. It's for the talofibular ligament. You should not be able to see that fossa. So that tells me this cannot be a right fibula. If I put it on my left leg, now here's the lowest portion of my lateral malleolus. It's as close to my ankle as I can get it. I cannot see the malleolar fossa. If I rotate it this way, now not only is that not as close to my heel as I can get it, but I can see the malleolar fossa. So the best thing you do, put the head toward the knee, put the lowest portion of the lateral malleolus down to the heel bone so that you cannot see that malleolar fossa, and that will tell you which side. So this is a left fibula.